Hey guys, it's Dr. Brad and welcome back to the channel. In today's video, we're going to be covering some questions and confusion that I often see many of my new patients come into the clinic with. And it usually goes something like this. New patient comes in, I ask them about previous diagnoses, and they say, well, I've been diagnosed with hypothyroidism or Hashimoto's. I'm not sure, are those the same thing? And while there is some nuance between the two terms, by the end of today's video, you'll be able to clearly define what hypothyroidism is, what Hashimoto's is, and where the two terms overlap. And of course, if you like these kinds of videos and want to learn more about natural ways to support your thyroid, don't forget to like the video, subscribe to the channel, and also ring the bell. I post videos every single Thursday, and that'll let you know when a new video becomes available. My specialty is in helping women with Hashimoto's and low thyroid to lose weight and improve their energy naturally. And those two terms, Hashimoto's and low thyroid or hypothyroid, are so often used interchangeably, and yes, I'm guilty doing that as well, that it's hard for people who are unfamiliar with the definitions to know which is which. And it's really important that we do understand the difference because it makes a difference in the way we approach care and support. Because let's be honest, if we or our doctor doesn't have a firm grasp of our diagnosis or what's going on with our physiology, then we can't take proactive steps to actually see improvements and feel better. So let's start out today by talking about the big overarching diagnosis that most of us are familiar with, which is hypothyroidism. When it comes to hypothyroid, we all know the symptoms. Hypothyroid, hypo meaning low or under, think of something like hypothermia, which is low body temperature, means that we have a low functioning thyroid symptom. And when we have low thyroid output, it slows down our metabolism, and that can show up in a variety of ways. If our body systems are starting to slow down, we'll see things like fatigue, weight gain, hair loss, gut dysfunction, dry skin, weak nails, and brain fog. And hypothyroidism is a description of these symptoms plus the associated changes in lab values. So although hypothyroidism is a diagnosis, by itself, I don't find it to be a very useful one. And I sort of group it together with things like IBS or fibromyalgia, where they're just descriptions of symptoms rather than an explanation of what is actually going wrong with our physiology. So if you have any or all of the symptoms that I just listed, plus your TSH is elevated on your blood labs and your total or free T4 is low, then you will be diagnosed with hypothyroidism. But again, that doesn't tell us anything about why the TSH is high, why the T4 is low, and if there's any other contributing factors that are affecting your symptom presentation. Here's an easy way to think about it that I use to explain things to my patients all the time, and I've probably mentioned in other videos. But if you have right knee pain and you go in to see your doctor, you want them to help you understand what the cause of that knee pain is. Did you sprain your knee or did you tear your ACL? Depending on the cause of the problem, it's going to dictate different treatment outcomes or ways that we approach things. If you just sprained your knee, then you likely need to ice and rest. But if you tore your ACL, you might need to get surgery. And the last thing that we want is to come into our doctor, say we have right knee pain, have them do a quick Google search of our symptoms and just confirm what we already know, giving us the diagnosis of right knee pain. That's just a description of the symptoms, and it doesn't help us to take action or get better. In a sense, telling someone they have hypothyroidism without qualifying it is like diagnosing them with knee pain. Hypothyroidism is just an umbrella term or an overarching category that includes a collection of symptoms and lab value changes that we mentioned before, but does nothing to tell us about the cause of the problem or look into the variability that can occur in someone's thyroid pathway from individual to individual. So if hypothyroidism is the umbrella term, what is the qualifier or cause of these changes? And that takes us to our second definition, which is understanding Hashimoto's. Hashimoto's is an autoimmune condition involving our thyroid gland. Autoimmunity occurs when our immune system makes antibodies which are normally to help protect us from infections, for the proteins and enzymes in our thyroid gland, leading to a decrease in thyroid function and activity. Hashimoto's is primarily confirmed through blood testing and can be identified by the presence of positive TPO antibodies, positive TG antibodies, or both. One quick side note, these antibodies can also be positive in Graves' disease, which is autoimmune hyperthyroidism. However, there are some key differences where Graves' disease will have hyperthyroid symptoms in addition to positive TSI, which is an antibody that stands for thyroid stimulating immunoglobulin. If TSI is negative and we're having low thyroid symptoms, then we can reliably say that the positive TPO and TG antibodies are indicators of Hashimoto's. But don't worry about Graves' disease at the moment. Let's continue to focus on hypothyroidism and Hashimoto's because this is where things can get a little bit confusing. These antibodies are the defining characteristic of Hashimoto's. But just because these antibodies are present on your blood labs does not mean that you have hypothyroidism, because autoimmunity is a progression. In the early stages of autoimmunity, even though the antibodies are present, not enough damage has occurred to impair the function of the gland or cause you symptoms. However, over time, we go from a scenario where the antibodies are only causing mild or minimal irritation to our thyroid to the point where the damage is so great that our ability to produce thyroid hormone becomes compromised, and that's when we start seeing hypothyroid symptoms. And this is why things can be confusing. Hashimoto's is an autoimmune condition that is characterized by the presence of antibodies that progresses over time. But just because you have those antibodies doesn't mean that you have hypothyroidism. However, there is an increased likelihood that you will eventually progress to hypothyroidism if you don't take intervening action. And due to the fact that thyroid antibodies can show up many years before we're diagnosed with hypothyroidism, I think it's prudent for anyone who's dealing with low thyroid symptoms to be screened for thyroid antibodies and see if that sort of progression is occurring and if it is contributing to your symptoms. But let me know in the comments below if your doctor has screened you for TPO and TG antibodies to help you better understand where you're at in the disease progression and also allow you to take proactive measures to get things moving in the right direction. So now that we know that hypothyroidism is a general term for low thyroid symptoms and lab changes, and Hashimoto's is an autoimmune condition that targets our thyroid gland, where do these two terms intersect? Well, if you've been following along with the information, you've probably guessed what comes next. Hashimoto's hypothyroidism is the most progressed stage of Hashimoto's and is defined by the presence of antibodies that we talked about before, which have now damaged the thyroid gland to the point where we have a compromised ability to produce thyroid hormone and our TSH has now elevated and our T4 levels are low. Essentially, the autoimmune activity has gone on for so long or has been so severe that our thyroid gland cannot function like it used to be able to. At this stage, this is when our thyroid hormone replacement medication can be more effective because our natural production of thyroid hormone has dropped below the normal threshold. However, we can't forget about the initial cause of the low thyroid hormone, which is the abnormal immune system function. Therefore, we have to support our immune system as well, otherwise we're going to require more and more medication over time. Medication is very limited in what it can do to support our immune system, which is why we have to use natural strategies like diet, nutrition, exercise, sleep, and stress management to help take some of that pressure off of our thyroid gland, allow it to heal, and see a reduction in symptoms overall. And if you're interested in working on your diet and making some changes, you can check out my video, What's the Best Diet for Hashimoto's That Gets Results? And I'll link that for you in the cards right up above. But hopefully you liked today's video and now have a better understanding of hypothyroidism, Hashimoto's, and how they interact. If you're looking for more information or would like some help with your thyroid symptoms, you can always send me an email at contact@seattlethyroidhelp.com to get a free one-on-one consultation set up with me to see if we would be a good fit to work together. Also, don't forget to grab my free download, which is Electrolytes for Hashimoto's and Keto. If you've adopted a low carbohydrate diet and are still dealing with some fatigue, lightheadedness, and muscle cramping, electrolytes could be your problem. In the download, I include a recipe for you to use and also strategies for you to adjust the dosages up and down depending on your needs. Finally, if you've been enjoying the information in my videos, don't forget to come say hi on social media. The links for my Instagram and Facebook page are in the description box down below. I'd love to see you over there and have you join the conversation. But that's all for today's video. If you like the content, do all the good things, give it a thumbs up, share it, subscribe to the channel. Thank you so much as always for the support, you guys. I hope that you're doing well, and if there's anything you need, feel free to reach out. My name is Dr. Brad Bodle. I hope you have an outstanding week, and I will see you next Thursday.